Okay, let's kick off this explainer by stating the obvious. Pretty much nobody actually enjoys getting a shot. Whether you're a little kid dreading a routine vaccine or an adult who needs frequent injections for a chronic condition, that anxiety and discomfort, yeah, it's a completely universal human experience. But what if the science of the future could make that fear completely obsolete? Imagine walking into a clinic, rolling up your sleeve, and instead of pulling out a sharp metallic needle, your doctor uses something entirely different. A device that never actually physically pierces your skin, yet perfectly delivers your medication right where it needs to go. It sounds like straight-up science fiction, right? Well, thanks to some groundbreaking research, it's quickly becoming scientific reality. Section 1. The needle problem. Why we need a change. To really appreciate this incredible innovation, we first need to talk about why we so desperately need an alternative to the traditional syringe. And it's not just about the ouch factor. It's about the biology of what happens when a needle enters the body. Hypodermic needles physically tear through tissue, which causes localized pain, bruising, and prolonged inflammation. Now, you might be thinking, hey, don't we already have needle-free injectors? Well, we do, but current needle-free tech is often incredibly electrically complex. They use these heavy, high-energy actuators that generate excessive, uncontrolled pressure. That pressure basically disrupts tissue integrity and hurts patient comfort. Essentially, they can be just as aggressive as the needle itself. So we've kind of been stuck between a rock and a hard place. Section 2. Rocket science meets medicine. This brings us to a literally mind-blowing solution where spacecraft propulsion principles are being used to cure needle anxiety. That's right, we're looking to rocket science to fix a medical problem. Instead of a needle, researchers developed what's called a microcity nozzle. The CD stands for converging diverging. This is an aerospace-inspired microscopic nozzle designed to propel liquid medication straight through the skin using controlled supersonic expansion. By regulating the aerodynamics of the liquid jet, it achieves energy-efficient, low-pressure, and completely minimally invasive drug delivery. Looking at the actual 3D printed model, the setup is fascinating. You have a converging section where the fluid accelerates, a tiny, narrow throat where it hits the speed of sound, and then a diverging outlet where it expands and reaches supersonic velocity. It is the exact same geometric principle used in actual rocket thrusters, just miniaturized into a medical device that's mere millimeters long. But of course, you can't just build this out of any old plastic. They built this device using a rigid UV-cured photopolymer called Vera White Plus, or VWP. Why does that matter? Well, when you're pushing liquid at supersonic speeds, standard materials would just warp or melt under the intense pressure. VWP gives them extreme mechanical and thermal stability. Plus, it offers unbelievable dimensional precision for 3D printing at the microscale. And it's chemically inert, meaning it won't react with or degrade the medication passing through it. The whole journey of this research is just a masterpiece of engineering. It kicks off with advanced computer optimization to find the perfect aerodynamic shape. From there, it moves into the actual 3D printing of the nozzle to test the real-world jet dynamics. And finally, it ends with precise, painless skin penetration and biological tissue. It is a perfect, seamless pipeline from abstract math to tangible medical relief. Section 3. Designing the perfect nozzle. So how did the scientists actually find the perfect geometric shape to make this microjet work flawlessly? Because at the microscale, being off by even a fraction of a degree changes absolutely everything. Rather than just guessing and checking, which would take forever, they utilized a highly advanced statistical technique called Latin hypercube sampling, or LHS. Think of LHS as a super efficient mathematical shortcut to test thousands of different nozzle shapes. It varies the internal converging and diverging angles, the lengths, everything just to find the absolute perfect configuration that maximizes jet velocity while minimizing pressure loss. And the result of that optimization, it is nothing short of incredible. This optimized micronozzle creates a drug microjet that travels at a supersonic speed of nearly Mach 3. That is roughly 3 times the speed of sound. At that intense velocity, the liquid essentially becomes its own microscopic needle, fully capable of passing right through the microscopic pores of your skin without physically tearing the surface. In their study, the researchers noted the optimal design point was identified at an area ratio of 3.900, an NPR of 3.22, and a Mach number of 2.877. Now, what you should actually take away from that highly technical quote is that this precise mathematical configuration guarantees aerodynamic stability. Without this exact area ratio, which, by the way, pairs a converging angle of 21 degrees with a diverging angle of 8 degrees, the jet would be totally chaotic. But here, the flow is stable enough to pierce the skin perfectly without causing widespread tissue trauma. Section 4. Testing the microjet. In vivo validation. Okay, so we have the rocket science math, and we have the 3D printed material. But how does this actually hold up when tested in real biological tissue? Well, researchers didn't just jump straight to in vivo testing. First, they set up a highly sensitive platform to measure the exact impact force of the jet. By placing a specialized force sensor beneath the nozzle at varying distances, they proved that the microjet maintains its coherence and energy stability exactly 5 to 15 millimeters away from the skin. That's huge because it gives doctors a comfortable, reliable working distance to administer the dose perfectly every time. When they finally did move to biological testing on rat models, the crucial metric they discovered was 1,500 micrometers. That is the exact depth the medication penetrates. And why does 1,500 micrometers matter? Because that depth perfectly reaches the dermis-hypodermis interface of the tissue. That's the highly vascularized layer of your skin where systemic absorption happens most efficiently. It doesn't just splash on the surface, it goes exactly deep enough to be carried straight into the bloodstream. You can actually see visual proof of this when they used a biological blue dye. The precise injection sites on the rat tissue show that the jet flawlessly deposits the liquid exactly where it belongs. When they analyzed the tissue afterward, the dye was uniformly distributed right in the target layers, without tearing or shredding the surrounding collagen architecture at all. The success data from the in vivo testing is honestly staggering. The researchers confirmed an intact epidermis with absolutely no surface rupture. They saw uniform drug distribution in the dermal layers. There was zero tissue fibrosis or hemorrhage, which means absolutely no bleeding and no bruising. And finally, using advanced mass spectrometry, they confirmed the systemic uptake of a model drug right into the bloodstream. The device is completely effective, delivering the medicine with virtually zero localized damage. Section 5. The future of injections, a painless tomorrow. So what does this brilliant mashup of aerospace engineering and pharmacology actually mean for the rest of us? It means we are finally bridging a massive gap in medical technology. For years, needle-free systems either couldn't deliver enough volume or they were way too violent and painful. But this VWP micro-CD nozzle combines ultra-fine penetration control with sufficient drug delivery capacity. We finally have a viable, low-cost, 3D printable tool that delivers real medication volumes gently, effectively, and entirely painlessly. Can you imagine walking into a clinic or a hospital and not seeing a single hypodermic needle anywhere? Where the anxiety of a doctor's visit practically vanishes for billions of people? Well, as this incredible aerospace-inspired technology continues to evolve, that painless future isn't just some sci-fi dream anymore. It's arriving, quite literally, at Mach 3.